Hello everyone, this is Tyler again with Massage AME. I am looking at this article in the most recent Massage and Bodywork magazine of September and October of 2023, that is. Before I get into reading this article, I need to ask you to please subscribe to this channel. It really does mean a lot to me, guys. Thank you. So I was taking a look at this most recent issue here, that is of the months of September and October of 2023. Whenever they send out these magazines, Massage and Bodywork, it's always for 2 months that the issue is designed for or written for, published for, however you want to put it. And whenever I take a look at these magazines, I try to find an article or two that really seems to catch my attention or catches my eye, no pun intended, because the content of this video, or the topic of it rather, is how bodywork can impact client vision. And this is by someone by the name of Mary Beth Sinclair. So I want to take a look at a few of the key points here. Actually, it says, not only do stress hormones trigger responses like making your heart race, breath quicken, and muscles prepare for action, but the eyes react to emotional influences as well. When a stress response keeps firing day after day, it can affect vision in a way that leads to struggling to see, and the typical response of eye strain, eye tension, headaches, stiff neck, back and shoulder pain, and body aches. So those are two key points just right off the bat. And I was looking over because I have long, in my practice, have heard many different experiences that people have had when working on the neck, shoulders, upper back, and how mostly because people come in for headaches and the like, but there does seem to be some correlation to vision problems as well, and I can relate to that personally, having had some body work and experiencing migraines and things like that. I noticed that, yeah, even my vision improves. That's purely anecdotal, I know, but I did want to bring that to point here all the same, because I think it's proven to be true in some ways. And what I have found, well, it mentions some other things that can lead to vision problems. Of course, there's diabetes. It naturally creates ongoing eye pain, eye fatigue, and neck strain, and an increased chance of headaches. That's what it says specifically here. It actually is a complication that's otherwise called diabetic retinopathy. And so can massage possibly help with that? Yeah, I'm sure it can, or holistic practices in general. But we are specifically focusing on muscles as a massage therapist. We need to remember our scope of practice. Let's take a look at emotional stress, which is something that this article also does specifically point out. Emotional stress is a big thing to always target and to focus on when dealing with people who have neck tension, headaches, and again, what they say here, if their vision is affected by it, well, look at it this way. When you're stressed out, think of it in its most primitive form. If you were, back in caveman times, the natural response is for your shoulders to go up like this. You start wearing them like earrings. They're up to your ears, right? Well, if that saber-toothed tiger is chasing you, you're trying to protect your neck. And when a lot of people do that, they say, oh, I carry my stress in my shoulders. I carry it all in my neck. It's more or less a true statement. So yeah, they do this. And so the idea is to help alleviate not just the tension in the neck and the upper back and the shoulders, but also additionally in massage, our goal is to, as it always should be, in my opinion, is to reduce the stress level in the individual, change that positive feedback in the nervous system to a negative feedback, so there isn't that continuous stress trigger that is causing them to be in that contracted state. Another condition, otherwise known as myopia, and I hope I'm saying that right, myopia, don't get upset with me, please. But anyway, Nearsightedness is the layman term, and upper body tension certainly is a problem for a lot of people right now, not just because of stress, but computers, smartphones, tablets, whatever. A lot of people are looking down a lot more these days, and that's going to put a lot of tension on the upper back muscles and the neck as well. But if you think about it, people who are more nearsighted, their tendency is to want to try to get closer to something to be able to see it better. And so, you know, they're going to have this hunch. It's going to cause a lot of tightness in muscles like this trapezius, the SEM, the sternocleidomastoid. It's going to cause tension in the scalenes, so on and so forth. We're going to get to that momentarily, and things that you probably should do, to what you should focus on when dealing with people who might have a symptom such as vision problems. Would it be expedient, by the way, to possibly ask people if they have any eye or eyesight issues in a pre-interview before giving them a massage? It may very well be, but it just depends what they're coming to see you for to begin with. You don't want to be random about it. Don't just ask them, are you having eyesight trouble? That would just be weird. But, you know, someone is saying, I have constant headaches, constant tension in my neck, even the jaw for that matter. Yeah, it may be okay to mention, you know, have you had any vision problems too, by any chance? And then you go from there, which will continue. Let's see here. What else does this amazing article tell us? It says it right here, actually, come to think of it. In step 1, when talking to your clients about this sort of thing, it says very well indeed, you know, you should ask them about it. And when they come to see you, you know, ask them about their chronic neck and shoulder tension. Wearing glasses, do they feel like they have to strain a lot? Is there a lot of discomfort, especially after working in front of their computer or whatever their device may be? It may open up a conversation with your client too, that especially if they do wear glasses, it's you know, maybe you should ask them, have you noticed any significant difference over however many massages you've been doing with this particular client? Has your vision improved at all? Has anything changed? And who knows, they may find that their glasses are no longer necessary. It could happen. Also says here, and another step is to note head tilts or twists. That can be indicative of people's eyesight, also possibly even just spatial awareness too, incidentally. And make sure you are addressing these, you know, those areas of tension indeed, if you are going to be asking your client about these sorts of issues. And so there's other complementary therapies out there too. Again, we want to focus more as a massage therapist on this channel, but there's many things that people can do. There's acupressure or acupuncture, of course, too. First and foremost, I just want to make sure that I state this, that always consult a medical doctor if you're uncertain about any treatment that you might receive. Also, as a massage therapist, if you are uncertain of any medical condition that a client may have, make sure that you also advise your client to consult their doctor and even present you with a doctor's note if necessary. So let's see, what else do we got here? Clients can also do self-massage. That is something I do try to address on this channel also, is trying to get people to understand that they can take matters into their own hands, to some extent anyway. But one thing I like to specifically mention for self-massage is the sternocleidomastoid. It's that most prominent muscle on the front of your neck here, on either side. It's a muscle that does seem to be closely related to chronic headaches also. But interestingly enough, I remember reading somewhere before that there are receptors in this muscle that do send some feedback to the brain that actually help your proprioception, your sense of space where your head is in relation to the rest of your body. And if there is a lot of tension in that area, it can cause dizziness, it can cause some vision issues, vertigo, other things I'm sure I'm missing at this moment. But the SCM is probably one of the most key muscles you can focus on when it comes to people complaining of headaches and vision problems in general, in my opinion. So yeah, you can certainly encourage a client to even work on their own SCM. You know, just do this sort of thing. Use the pincer technique. You know, your 2 fingers and your thumb. Just, you know, it doesn't have to be rough, gentle massage. You know, so just one thing to think about. Also, mention getting more ergonomic work situations or work environments rather. And, you know, try not to put too much stress and strain on your cervical muscles. You know, don't want to be leaning forward all the time. Get that hunch, you know. Try to encourage clients to be more aware and conscious of their posture. And, you know, being upright, up straight, trying not to tilt their heads too much, which is a bad habit I have, incidentally. So just, again, these are things to talk about with your clients. Again, the muscles that I would specifically focus on, in addition to the SCM, I would also focus on the trapezius muscle. I would also focus on the scalenes. Those are some 3 big ones right there. Levator scapulae. And there is also a splenius capitis and splenius cervicis. Splenius cervicis is a deeper muscle, so you may not affect it directly, but certainly it can be helped by working on the other muscles. So that deals more with the cervical area, but if we want to talk about some of the muscles in the face and the jaw, we have our masseter, the temporalis muscle, frontalis, and so those are just to name a few. And as a massage therapist, hopefully you are equipped with these techniques. And as a client, don't be afraid to ask your therapist, you know, how familiar are you with the neck, the jaw, shoulders? How familiar are you with those areas? It's totally okay for you to ask those kinds of questions. So I'm not saying, you know, go and be a jerk to a massage therapist. We are humble in our profession, okay? But all the same, it's okay for you to ask. Is this something that they are very familiar with? And you know, you're doing your shopping for your therapist. And once you find that right therapist for you, hey, stick with them, okay? So at any rate, I hope that this was enriching to you to hear a little bit about this article and things that you could possibly do both as a therapist and as a client. And again, you know, that's what my goal here on this channel, to everybody out there, to the therapist and client alike, is to make you, or help make you, shall I say, more able at the massage table. Because as a massage therapist, I want you guys to feel more confident in your practice. And as a client, I want you guys to feel like massage is definitely worth it. There's still a lot of stigmas out there, and I'm hoping I can dispel some of those things about massage therapy that just simply need to go away. But if you did like this video, please give it a thumbs up. And please also subscribe to this channel. I do put a lot of work into this stuff, guys. It does mean a lot to me to have people subscribing to my channel. So thank you again, and stay tuned for the next video. Take care now.